Hello, I'm Dr. Christopher Brennan, founder of Long Island Aftercare. I created Long Island Aftercare because I saw firsthand how overwhelming and confusing the healthcare system can be for patients. Imagine this situation. A 75-year-old family member is sitting at home here on Long Island in West Islip, New York, and suddenly, about 10 minutes ago, something changes. Their words are not making sense. They're trying to speak, but the sentences sound confused or garbled. You notice one side of the face drooping. Maybe the smile looks uneven. Maybe one arm suddenly becomes weak. Maybe they seem confused or cannot answer simple questions. This could be a stroke, and what happens next may dramatically affect whether that person walks, talks, functions independently, or survives. I'm Dr. Christopher Brennan, internal medicine hospitalist physician, and today I want to explain exactly what families should do if stroke-like symptoms suddenly begin. The first thing, do not wait. Do not say, let's see if it gets better. Maybe they're tired. Maybe we should wait a little. Maybe it's stress. Time matters. In stroke care, we often say, time is brain. Every minute during certain types of strokes may mean permanent brain damage. If symptoms started only 10 minutes ago, this is a medical emergency. Step 1, call 911 immediately. Do not drive the patient yourself unless absolutely unavoidable. Why? Because EMS can begin treatment and evaluation immediately. They can check blood sugar, oxygen levels, blood pressure, heart rhythm, and alert the emergency department before arrival. That allows the hospital stroke team to prepare in advance. If you live near Good Samaritan University Hospital or elsewhere on Long Island, EMS personnel are specially trained to recognize stroke symptoms and determine which hospital may be most appropriate. And families should understand, not all stroke centers are the same. There are different levels of stroke centers. Primary stroke centers are hospitals equipped to rapidly evaluate and treat many common strokes. They typically provide emergency stroke evaluation, CT imaging, neurology consultation, and clot-busting medications when appropriate. Comprehensive stroke centers provide an even higher level of advanced stroke care. These hospitals often manage large vessel occlusions, complex brain hemorrhages, advanced neurocritical care, neurosurgery, and specialized neurological interventions. Some hospitals are also thrombectomy-capable stroke centers. A thrombectomy is an advanced procedure where specialists physically remove a clot from a blocked blood vessel in the brain using catheters and specialized devices. For certain major strokes caused by large blood vessel blockages, thrombectomy can dramatically improve outcomes. But timing is critical. That is why EMS may sometimes bypass a closer hospital and transport a patient directly to a more advanced stroke center if they suspect a severe stroke. Families sometimes become upset and ask, why aren't we going to the closest hospital? The answer is because getting the patient to the right stroke center quickly may save brain function and improve survival. Step 2, look at the clock. One of the most important questions the medical team will ask is, when was the patient last known normal? Not when you noticed the symptoms. Not when EMS arrived, not when they got to the hospital. The key question is, when was the last moment the patient was definitely normal? That exact time can determine whether the patient qualifies for clot-busting medications, advanced stroke interventions, or thrombectomy procedures. So if symptoms started 10 minutes ago, remember the exact time. Write it down if needed. Step 3, know the warning signs. Think fast. F, facial droop. A, arm weakness. S, speech difficulty. T, time to call 911. Other stroke symptoms may include sudden confusion, vision loss, difficulty walking, loss of balance, sudden dizziness, numbness, or severe headache. Step 4, do not give food, water, or medications unless instructed by medical professionals. Stroke can affect swallowing and increase choking risk. Step 5, gather important information. Try to find medication lists, blood thinner information, medical history, allergies, insurance cards, and emergency contacts. Very importantly, tell EMS in the hospital if the patient takes medications such as Eliquis, Xarelto, warfarin, Plavix, Brilinta, or aspirin. Step 6, keep the patient safe. Help them sit or lie down safely. Do not allow them to walk unassisted. Do not let them sleep it off. Stay calm, speak reassuringly, monitor their symptoms. Step 7. At the hospital, expect rapid evaluation. Stroke workups move very quickly because treatment decisions are extremely time sensitive. The patient may undergo CT scans, CT angiography, brain imaging, blood work, heart monitoring, neurology evaluation, and emergency stroke consultation. And families should understand something very important. Even if symptoms improve, the patient still requires emergency evaluation. Sometimes stroke symptoms temporarily improve before worsening again. Never ignore sudden neurological symptoms. My advice to families is simple. Know the warning signs. Act fast. Call 911 immediately. Do not delay. Do not assume symptoms will pass. Fast treatment can save brain tissue, preserve speech, preserve movement, and sometimes save a life. I'm Dr. Christopher Brennan. Visit liaftercare.com for more educational resources helping patients and families better understand stroke symptoms, hospitalization, emergency care, rehabilitation, discharge planning, and navigating the healthcare system. Thank you for watching and welcome to the Long Island Aftercare platform. We encourage you to explore our new Patient and Family Education Center at liaftercare.com, a growing educational knowledge base designed to help patients, families, and caregivers better understand the healthcare journey. Our platform answers many of the most common questions people have during hospitalization, discharge planning, rehabilitation, recovery and post-hospital care, and more. We understand that during stressful medical situations, emergencies, or after receiving difficult news, it can be overwhelming to absorb and remember everything healthcare professionals are explaining. That is why Long Island Aftercare was created, to provide clear, easy to understand educational resources that patients and families can access anytime at their own pace. Be sure to explore our powerful Map Resources section, which allows you to search and filter healthcare facilities and services throughout Long Island and surrounding areas based on the criteria most important to you. You can filter by affiliated healthcare system, clinical capabilities, inpatient versus outpatient services, specialty care, rehabilitation options, skilled nursing facilities, home care services, county location, and much more, helping patients and families make more informed healthcare decisions. Our goal is to improve communication, education, transparency, and healthcare navigation for patients, caregivers, and families during some of the most challenging moments in life. Please follow Long Island Aftercare on our social media platforms for ongoing educational videos, healthcare updates, patient resources, and new content. YouTube, Facebook, Instagram, X. Thank you again for watching, and thank you for being part of the Long Island Aftercare community.